Hello everyone, my name is David Cragg. I'm very pleased to be able to stand here today in front of you and share some of the thoughts that I have as a patient in the NHS. And I think any anniversary is an opportunity to celebrate what has been achieved, but it's also an opportunity to look back and reflect on the starting points and what was actually important then and how that can actually impact the future. So 7 is a recurring theme throughout all of this. I have 7 slides, and I'd like to start by showing a little bit about my journey so you understand where I am. Not 70 years, only 7, you'll be pleased to know. So in March 2011, my relationship with the health service changed considerably. From somebody that had very little interaction, apart from maybe going for immunisations for holiday, I turned into somebody that requires the health service to stay alive. And I'm very grateful to the NHS for allowing me to stand here today. My career has been in business intelligence. I've worked for a global financial company, working with data, customer data. And in my journey throughout the health service, I've been very surprised at the differences with how banks deal with customer data and how healthcare deals with personal data. And there's a lot both industries can learn from each other, and part of my discussion really is about that. So back in 2014, I blogged about free diabetes phone apps to help patients on their journey throughout their diabetes journey, to help them work out where they're going wrong in terms of their management, and to improve it, and to show that actually the true cost of these isn't free. There is actually a cost involved, and that's privacy. I'm the unit of currency in the digital age, and sometimes that cost can seem very high. So let's look back. 3 core principles that the NHS was founded on. That it met the needs of everybody, free at the point of delivery, based on clinical need, not the ability to pay. And there's a quote there, usually attributed to Bevan, but in fact most probably isn't, but a very good summary of his feelings around what the NHS would mean. And I think it's important that we reflect on that in the terms of the digital age and where things are going. 7 again, 7 principles. I won't go through them all, you most probably know them all very well. I think for me, the important ones are most probably the 3rd, the 4th and the 7th, about highest standards of excellence, putting the patient at the heart, and being accountable. And I'll draw on those themes in a moment. Because the future's quite exciting in healthcare. You know, cognitive computing, artificial intelligence, data mining, big data, data lakes, blockchaining. There's all sorts of things going on. Lots of things offering a lot of value and potential value in the future in terms of saving the NHS money, improving outcomes. And I worry to a certain extent that excitement is forgetting some of those earlier principles, and we need to remember what that data actually is. When you're in a healthcare setting with a GP, it's a very personal relationship. When you're looking at patient data in a hospital, say in reports, there's still that patient. There's still that patient element. When it goes into a big data lake, that's lost a little bit, and we need to remember that actually those data points are people. And those people, even though they're in digital form, care about what's being done with their data. So challenges: public trust, education engagement. Medical data holds huge potential and huge risks. When it's leaked, it can't be unleaked. When the public trust is gone, it's very hard to rebuild. And the problem is we have more actors. It's not just the NHS. It's tech companies getting involved, it's fitness apps. They're all collecting data. And a little example there you most probably can't see. A diabetes app records the time, the location, the picture of your food, blood glucose, carbohydrates, insulin, meal type, how many pills you've taken, and the list goes on. A lot more than what's actually required to deliver care, but very, very useful data. So there's more risk with the more data you collect, but potentially more reward. So my 7 thoughts to finish. Free at the point of delivery. What do we mean by free in the digital age? How much cost is there to me in terms of my privacy? So put patients at the heart, not as an afterthought. Involve us early. Don't be scared to have the discussions. That helps you be accountable to the public and to the patients that you serve. Make sure that data governance is there, and it's great to hear some of the conversations that are going on outside of here around that. That digital patient's a real patient. So lead the way on privacy and data rights. So embed it everywhere, in policy, procurement, provisioning. Rebuild the trust that's been lost along the way. You know, data will leak, things will happen, but if you take patients on the journey, take the communities on the journey, they can forgive that, and they can work with you to build a better future. So build that trust, and I think the way to do that is remembering those 7 principles that started it all off. Thank you.